Welcome to Bipolar Talks, where we delve deep into the complexities of mental health to bring you insightful, thoughtful discussions. Before we begin today's episode, I encourage you to listen mindfully, absorbing the information with care, and taking your time with the content. Mood swings can be a confusing and difficult topic to navigate, but understanding the science behind them is the first step toward greater awareness. If you find this discussion helpful, please take a moment to like, comment, subscribe, and share this video with those who might benefit from this information. Let's work together to break down the stigma and educate ourselves on what really matters. Now let's dive into today's topic, the science of mood swings. Mood swings are something many people experience, but for those dealing with mood disorders, they can be much more intense and disruptive. From feeling euphoric one minute to being overwhelmed with sadness the next, mood swings are a hallmark of many mental health conditions, including bipolar disorder, depression, and anxiety. At their core, mood swings refer to dramatic shifts in emotional state that can be unpredictable and difficult to manage. For some, these fluctuations are mild and occasional, but for others they are more extreme and can significantly impact daily functioning, relationships, and overall quality of life. In this episode, we'll take a deep dive into the science behind mood swings, exploring the neurological, biological, and psychological factors that contribute to these emotional shifts. Understanding the mechanisms behind mood swings not only sheds light on conditions like bipolar disorder, but also helps us build empathy and offer better support to those who experience them. Mood swings are defined as noticeable and significant changes in a person's emotional state. These shifts can involve transitions from extreme happiness, or mania, to deep sadness or depression. While it's normal to feel emotions like joy, sadness, and frustration, mood swings in the context of mood disorders are often more intense and less predictable. There are several factors that contribute to mood swings. 1. Genetics. Family history can play a significant role in predisposition to mood disorders. If you have a close relative with a mood disorder like bipolar disorder, you may be at an increased risk of developing similar conditions. 2. Chemical imbalances. Neurotransmitters, chemical messengers in the brain, play a vital role in regulating mood. Imbalances in neurotransmitters such as serotonin, dopamine, and norepinephrine can contribute to mood instability and mood disorders. 3. Stress and life events. External triggers like significant life changes, trauma, or ongoing stress can act as catalysts for mood swings, especially for those already vulnerable due to genetics or chemical imbalances. 4. Hormones. Hormonal fluctuations, such as those experienced during puberty, pregnancy, or menopause, can affect mood regulation and contribute to mood swings. This is often seen in conditions like premenstrual dysphoric disorder, PMDD. 5. Sleep disruptions. Sleep plays a crucial role in emotional regulation. Lack of sleep or disruptions in sleep patterns can exacerbate mood swings, creating a cycle where poor sleep leads to mood instability, which in turn makes it harder to sleep. To understand mood swings, we must look at the brain's biology and its role in emotional regulation. The brain is composed of complex systems that work together to manage mood, thoughts, and behaviors. When one or more of these systems is disrupted, mood swings can occur. The role of neurotransmitters. At the heart of mood regulation are neurotransmitters, chemical messengers that allow neurons, brain cells, to communicate with each other. The most commonly studied neurotransmitters related to mood regulation include serotonin, often referred to as the feel-good neurotransmitter. Serotonin helps regulate mood, appetite, and sleep. Low levels of serotonin have been associated with depression and mood swings. Dopamine. This neurotransmitter is involved in pleasure and reward. High levels of dopamine are linked to feelings of euphoria, as seen in manic episodes, while low levels can lead to feelings of apathy or lack of motivation, which is common in depressive episodes. Norepinephrine. Often called the stress neurotransmitter, norepinephrine is crucial for the body's fight-or-flight response. When levels are too high or too low, it can lead to increased anxiety, hyperactivity, or depression. Imbalances in these neurotransmitters can contribute to the extreme fluctuations in mood that people with mood disorders experience. For instance, in bipolar disorder, an overproduction of dopamine can lead to manic episodes, while a shortage of serotonin can trigger depressive states. In addition to neurotransmitters, certain areas of the brain are specifically involved in regulating emotions and mood. Research shows that people who experience significant mood swings may have abnormalities in brain regions such as the prefrontal cortex. This area of the brain is involved in decision-making, emotional regulation, and controlling impulses. Dysfunction in the prefrontal cortex can impair one's ability to manage emotions, contributing to the severity of mood swings. The amygdala. The amygdala is responsible for processing emotions, particularly fear and pleasure. When the amygdala is overactive or underactive, it can result in exaggerated emotional responses, which is often seen in mood disorders. The hypothalamus. This brain structure regulates hormones and plays a role in stress responses. Dysregulation in the hypothalamus can contribute to mood swings, especially in response to stress. When these regions of the brain are functioning in unison, emotional regulation is more stable. However, when there are imbalances or disruptions, it can lead to extreme emotional shifts. Stress is another significant factor in the development and exacerbation of mood swings. Stressful life events, chronic stress, or trauma can act as triggers for mood disorders, causing shifts in mood and behavior. When the body experiences stress, the hypothalamus signals the release of cortisol, the body's primary stress hormone. Cortisol helps the body respond to stress by increasing heart rate and blood pressure. However, chronic stress can lead to prolonged high cortisol levels, which have been shown to disrupt neurotransmitter function and brain chemistry, making it harder for the brain to regulate emotions. In individuals with mood disorders like bipolar disorder or major depressive disorder, stress can act as a catalyst for manic or depressive episodes. This creates a cycle where stress leads to mood swings, which in turn creates more stress. In conditions like bipolar disorder, mood swings are more extreme and prolonged. Individuals with bipolar disorder experience periods of mania or hypomania, less severe mania, and depression. These mood swings can last for days, weeks, or even months. Manic episodes. During manic episodes, individuals may feel euphoric, invincible, or hyperactive. They may engage in impulsive behaviors, experience racing thoughts, or talk rapidly. These manic episodes are often marked by an increased risk of dangerous behavior, such as spending sprees, reckless driving, or risky sexual behavior. Depressive episodes. On the flip side, individuals may experience periods of deep depression, where everything feels hopeless. They may lose interest in daily activities, feel fatigued, and struggle with sleep, appetite, and concentration. These depressive episodes can be just as disruptive, affecting one's ability to function in daily life. While bipolar disorder is one of the most well-known conditions associated with mood swings, other disorders can also involve significant shifts in mood. Major depressive disorder, MDD. People with MDD may experience mood swings that primarily lean toward depression, though they can experience occasional hypomanic or manic episodes in conditions like cyclothymic disorder. Borderline personality disorder, BPD. Individuals with BPD often experience intense mood swings, particularly in response to interpersonal stressors. These shifts in mood are often quick and intense. Premenstrual dysphoric disorder, PMDD. PMDD is a severe form of premenstrual syndrome, PMS, that involves extreme mood swings, irritability, and depression. Anxiety disorders. Mood swings can also occur in individuals with anxiety disorders, as anxiety often leads to heightened stress, which in turn can cause emotional fluctuations. While it can be overwhelming to deal with mood swings, there are several strategies and treatments available to help manage them. Medication. For those with mood disorders, medications such as mood stabilizers, antidepressants, and antipsychotic drugs can help regulate mood swings. These medications work by balancing neurotransmitters in the brain, improving emotional stability. Therapy. Cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and other forms of psychotherapy can help individuals understand and manage the triggers and patterns of their mood swings. Therapy provides coping strategies for managing emotional responses and improving emotional regulation. Lifestyle changes, regular exercise, healthy sleep habits, and stress reduction techniques like mindfulness and meditation can also play a critical role in managing mood swings. A balanced diet and maintaining a routine can help stabilize mood and provide emotional grounding. Understanding the science behind mood swings can provide valuable insights into the challenges that many people face, particularly those with mood disorders like bipolar disorder. By exploring the biological, psychological, and environmental factors that contribute to these emotional shifts, we gain a deeper appreciation of the complexity of mental health. If you or someone you know is struggling with mood swings or mood disorders, it's important to reach out to a mental health professional for support and guidance. With the right tools, support, and treatment, managing mood swings becomes a much more achievable goal. Thank you for tuning in to Bipolar Talks today. If you found this discussion helpful, please make sure to like, comment, and subscribe to our channel for more content like this. Share this video with someone who might benefit from understanding the science behind mood swings. Remember, this video is for informational purposes only, and we encourage everyone to consult with an expert for personalized advice and treatment. Take care, and we'll see you next time.